Hello everyone, I am Mackenzie Graybill and this is case study 2 for class 638. So some of the intervention goals that we have made for this client include making eye contact and responding to name, and my BCBA and I have made the goals. So client X will make eye contact for 80% of opportunities across 3 consecutive sessions and at least 2 technicians. And for responding to name, client X will respond to their name by turning their head towards the speaker for 80% of opportunities across 3 consecutive sessions and at least 2 technicians. For responding to name, right now they do not have to make eye contact, as there is a separate goal for making eye contact. Another intervention goal that we have created was for their challenging or maladaptive behaviors, whichever you prefer. And so the client engages in physical aggression and tantrums. So for physical aggression, client X will decrease physical aggression from 10 occurrences per session to 2 or less occurrences per session. And for tantrum, client X will decrease tantrums from 120 minutes per session to 15 minutes or less per session. Keep in mind that the client is only 3 years old, so we base these goals based off of what a typically developing child would engage in at that age. Recommended behavioral interventions continued. So based on the client's assessment results, which was the VB map, the suggested interventions include one-step motor imitation, responding to name, and we will be using escape extinction to decrease physical aggression, property destruction, and tantrum. So escape extinction is recommended as a behavioral intervention because the function of the behavior is multiply maintained, with one being maintained by escape. Escape extinction is an evidence-based practice used to decrease behaviors that are maintained by escape from task demands. A replacement behavior that we are attempting to teach is requesting a break. Since the child is non-vocal at this time, we would recommend teaching him the sign for break or adding a break icon to his AAC device once insurance improves that and he gets that. The request of the break should be reinforced on an FR1 and then slowly intermittently reinforced. And that will go into gaining like assent for certain procedures during ABA therapy. Some unwanted effects of escape extinction. They can engage in novel behaviors during an extinction burst. As of right now, we should ignore and block as long as there's no serious threat to the safety of the client, yourself, or others in the area. It's important not to give these behaviors attention because we do not want to reinforce that novel behavior and then have the client engage in these behaviors in the future. So if you ignore them now and don't reinforce them now, then likely once the novel behavior and the the extinction burst is over, then it should not reappear, hopefully. So monitoring the client progress and treatment integrity during the session. Before beginning the treatment, all technicians should be and will be trained and evaluated on their knowledge and capability of performing the escape extinction procedure for this client. Supervision will be used to monitor treatment integrity throughout, and will be at 5% or more, depending on the client and technician's needs. 5% because that is the requirement from the BACB. If there is treatment infidelity, the technician will need to be retrained on the data collection procedures, and will likely be taken off the case for that time because giving attention to certain behaviors can essentially make your life harder when doing it and make everyone else's life harder. So they'll be retrained on how to ignore certain behaviors. Consent and assent. So the client has very little vocal skills, very minimal vocal imitation right now, very little verbal skills, starting to make some eye contact and manned with eye contact. But parental consent was gained at the outset of services. So we do have consent to provide these services. They have all been informed of what we will be doing. We update them daily when they pick up. And so since the child does have very little verbal and vocal skills, we will continue to teach him these skills in order to teach him to gain, in order to teach him these skills to ask for a break, and then have us gain assent later once the client has acquired more of these skills. It is a little difficult, but the child, as discussed with my BCBA, would not be able to give proper assent because they do not have these skills to communicate. So again, once they have these communication skills, we can come back to gaining assent and then provide a different task, maybe a more preferred task, or use those if-then statements with the client to gain assent. And then future thoughts. So we could hire bilingual staff and pair them with students who are also bilingual in the same language. So if we have a client whose parents spoke Spanish and English, but they were able to understand Spanish more clearly, we could hire a BCBA technician who speaks Spanish and pair them with this client so that the parents are able to have a more better understanding of what is going on. Another thing we can do, and that I have done with my BCBAs in the past, is provide documents in the client's and stakeholders' native tongue. Sometimes, from my experience, parents are really good at speaking English, but when it comes to reading it, they do have some difficulty. So providing that in their native tongue would keep them more informed as well, especially during like parent meetings and things like that. And then before the beginning of services, we can ask the client and their guardians if there are certain cultural, ethnic traditions that they would like us to uphold in therapy. So, for example, if the client was Jewish, teaching them to tact Santa Claus is not culturally appropriate. It's not really relatable. More than likely, they do not celebrate Christmas the way that a lot of people in the United States do. So understanding that would help them to provide better cultural, what's the word I'm looking for? Services, better cultural services. And then finally, being willing to explore their cultural traditions to provide the best care to the client. If the client is Buddhist or Jewish or Catholic, researching kind of those traditions and understanding them can help us to provide the best care. I know a lot of religions do not believe in ABA, but parents also understand that ABA is likely the best chance that their child has, depending on the severity of the case. So understanding their cultural traditions to provide the best care is really important as well. Thank you for listening.